viewers to My Startup TV. Today we are starting a brand new series of startup programs. Our unique capsule format will cover sector-specific news, views and stories. We hope you like it. I am Aishwarya Nair. Today in our Tech Today show, we bring the latest from the world of technology, drones and gadgets. Top headlines for today are: Google Chrome adds built-in screenshot tool. Latest Intel chip to give 5 GHz speed to thin and light laptops. Google Photos is ending its unlimited free storage. Before I proceed with today's news, I request our viewers to take necessary precautions as the battle against COVID-19 is not over yet. Remember, this is the time we fight the virus together. News for today are: Google's mobile browser Chrome for Android will have a built-in screenshot tool. The screenshot tool will be able to capture the entire screen, including the Omni-Box, with the bottom bar consisting of tools to crop, add text and draw. Intel has announced some exciting products at the virtual Computex 2021. The products include a pair of new 11th generation Mobile U chips with the first 5.0 GHz clock speed for thin and light laptops. Starting 1st June 2021, Google Photos is ending its unlimited free storage policy for pictures at high resolution. Now every Google Photos user will receive only 15 GB free storage space. Chinese smartphone maker Xiaomi has unveiled its latest HyperCharge fast charging solutions for its smartphone users. The 200 watts HyperCharge technology can fully charge an MI phone with 4000 mAh battery in 8 minutes. Two students of the Indian Institute of Information Technology, Delhi, have developed a bot which sends alerts to the users about open slots on the CoWin app. This will help in improving the chances for successively booking a slot. That's all for today.
Imagine the power of having all the information you need on your fingertips all the time. The reduction in your anxiety levels, stress levels when you're walking into a meeting, the confidence it gives you. Anything I want, it's there. Better decision making would lead to better business growth, better profits. If you're looking to do a startup, a few things is always you should know how to hustle. Don't expect things to come to you. You have to go and get things. Find real problems, not something you think is a problem, and find a solution which people will pay for, is sustainable.
Thank you. My Startup TV is a great initiative. I would say it is an enabler to the entire ecosystem of a startup and ecosystem to kind of put messages of different startups to public at large, and to make sure that startups are given due recognition and can express their business model or express their kind of information to the people around. There have been different, print media in the past, like Your Story and Traction and this kind of media, which have been there largely available on web. But this is the first interactive media, I would say, which is actually working in a 3-layered format basis. So I'm very happy to be here today and talk to my fellow panelists, as well as it's happy to see this getting, in a different 3-layered forums where we can reach out to different people or reach out to different population in the country.
Welcome to the Founder Talk Show, Mr. Rajat.
Thank you, Major. Thank you. Pleasure to be here.
Thank you for joining us. Let's start by understanding what's your company into.
Company's name is Sociorack, and we have launched a product called Highlight. So Highlight is a unified information management and business collaboration platform rolled into one. So we are a Make in India product. We are a unique solution, and we have patents filed in India, US, and a couple of other countries globally.
What is that unique factor that is there in your solution that you filed a patent for? What my understanding is that it's very difficult to get patents for softwares.
Yes, of course. Getting a patent for software can be tricky, but it also depends which country you're filing the patent in. And every country has its own system and rules. Coming to my product, the uniqueness in our product, so to explain that to you, I'll take you to give you an example to illustrate the point. Now, we are all used to folders or directories to store and manage our files. Now, imagine a world where you do not have folders and directories and you have to manage all your files. How easy or difficult does that sound, right? Some would be difficult, right? That is what I'm talking about, so the world has moved from 2D to 3D, 4D. So we are doing that for information. So we have always had folders. Now we are adding another element which we call tags. So tags help you interconnect pieces of information saved in multiple and different folders. So you could have 100 pieces of information or 100 files saved in 10 different folders of maybe 5 different formats, which can be interconnected by a single thread we call meta tag. And each piece of information can have 10 such meta tags, which is why we say we make your information 10 times more powerful.
As a layman who is not technologically as competent, how easy is it to use your solution? Is it just install it and integrate it across the platforms, or how does it work?
Let me ask you a question like, do you use email?
Yes.
And do you use any chat platform?
Yes, we do.
Any cloud storage?
We do as part of our work. Yes, we do.
And browsers?
Yes.
So if you can use these platforms, you'll have no problem using my product. In fact, our product is easier to use.
As a user, can I integrate your solution across devices and also different platforms? You have the iOS and the Android.
Sure. So when we started the product, we had a very clear basic thought that it has to be the go-to product, which means that it should work across Android, iOS, mobiles, desktops, tablets, laptops. In fact, one of the things we like to say as the use case for our product, let's say you're working in the office on your PC and you need to leave office or the office needs to close down. You just save it. You could continue working on your mobile. Once you reach your car, let's say you have a chauffeur driving it. You could, the chauffeur is driving and you can continue working on your tablet. You reach home, you decide to open up your laptop and you can continue working. So that's how seamless the product is made to be, that you can work from multiple places. In fact, each login or each sign up of the user allows them to use the product from 5 different devices simultaneously. So you could be logged on to your account at 5 different places, and anything you do at one place shows up in real time in the other 4 places.
As I understand, it is also designed for use by individuals like me, not necessarily just businesses.
It's useful for anybody who deals with a lot of information, who's using multiple apps and products, and who values their time.
That's amazing. As a common man, one of the first things that we always ask is, what's the cost? So is it a subscription model? Is it one-time pay? And how much does it cost for a user?
And Highlight is here to help you save a minimum assured 6.5, which amounts to just about 30 minutes per day. But when you add the numbers, you're looking at 140 hours per person per year, year on year. Just that much money, that much time can give you one long vacation which you want, time with the family or friends. So that is the tangible benefit which Highlight gives, significant saving of time. But I'm sure that there are a lot of ways to save time. But so that is the one you can measure. But then there are a lot of non-tangible benefits which have much greater value. Now coming to the cost. So let me ask you a quick question before I get into the cost. What would you say is the cost of 1 hour of time for you?
Depends on what my boss pays me, but well, I would say about 500 rupees probably.
Fair enough. So it's safe to assume that for most people, 500 rupees per hour would be a safe amount. Anybody paying in the higher scale, it can go up to 5,000 rupees an hour, right? And some of the consultants and other specialized people, their bills are way more than 5,000 rupees an hour, right? So what if I told you I can, like I mentioned, I can save you 30 minutes a day. We are looking at saving about 12 hours a month, right? So how much will you be willing to pay for that? I'm just trying to make it more interesting.
I can squeeze in my gym time into it, cycling time. A lot of things can be done into it. Exactly. I agree.
Absolutely. So our cost is 500 rupees per user per month or 5,000 per year. So you save 2 months if you pay for a year. Now that is an individual user cost or for low volume. But if we are looking at the business and they have a big number, these numbers can go down significantly.
One of the major things that we see in the past few months is about privacy and security. How would you assure the listeners that their data is secured with you and you are maintaining the privacy?
Obviously, no talk about any data platform would be complete if we do not talk about data privacy and security. So we have a few things on that front as well. So number one, we give all our users the option to have the entire data hosted on a server of their choice, preferably cloud. Local server is also possible, but we do not recommend for latency, speed, and a lot of other reasons. Now, if you see, I don't think any other platform gives you the option to have the entire data on your server. So that is one of the key things which we do, because we are not here to sell you cloud storage. We are here to sell you technology to make you work better and earn better. There are two problems which happen when an employee walks away with your business data. Firstly, the employee has data they should not have.
Yeah.
And secondly, many times the business itself doesn't have some of that data. So on Highlight, we have a solution for that. So the business admin can instantly, remotely pull back all data from any user's account or device. What if I said on Highlight, we give you, the sender, the power to decide whether I, as recipient, can reshare and re-forward any information received from.
That would be of interest to companies, definitely.
Yeah, so that is one of our killer features. So you as a business can decide who, where, and how your business data can be used. We do a lot of things. We have a multi-level password protection. We have end-to-end encryption. There are a lot of things we have. In fact, our feature list is pretty long because we are a complete solution. But I'm just talking about a few key things which address some of the biggest problems we all face as individuals and businesses.
I would like to know from you, we as a channel, MyServe TV, the channel for entrepreneurs and startups like yours, what are your thoughts about this channel?
Your channel is doing a great job by showcasing various startups and various founders doing that. So good job. Keep up the good work.
Thank you, Rajat. Thank you very much for joining us. And we look forward to hosting you on one of our panel talks relevant to your industry. Thank you.
No, I have always been a great fan. And I think coming from an academic background, why I feel so upbeat about this is not just an information channel or a channel which dishes out information or tries to create opportunities, but this has the potential to change the mindset of people. It's a thought influencer. It's an influencing channel. It has the ability to change the way people think. And not just startups, this has the ability to make established people think the way they think about startups as well. So I'm always upbeat when it comes to these kind of, when it comes to My Startup TV, because it plays more on the mind more than anything else.
दादी के हाथ का स्वाद याद दिलाए दादी मसाले.
Vaccines to be delivered by drones under the Government of India's path-breaking initiative. Welcome viewers to My Startup TV. I am your host Aishwarya. I am here with another episode of What's the Trend? Before I proceed with today's story, the battle against COVID-19 is not over yet. I request our viewers to take necessary precautions, always wear a mask, wash your hands frequently, and do not step out of your house unnecessarily. Please maintain social distancing. Remember, this is the time we fight the virus together. Under a new path-breaking initiative, Government of India has allowed Indian states to use drones for delivering COVID vaccines. Telangana was the first state to get permission for the pilot project. Speaking to a leading English daily, Jayesh Ranjan, the Principal Secretary of IT and Industries Department of Telangana, said that Telangana is one of the most proactive states adopting emerging technologies. Vaccinating over 1 billion people comes with its own set of problems, especially given the geographic conditions, scanty logistics, infrastructure and demography of India. As the famous saying goes, in a ship all hands on the deck, Government of India, by approving the use of drones for vaccine delivery, is basically deploying all resources at its disposal. Presently, drones may not be a game changer. However, under the pilot project, if drones end up delivering even a small percentage of the total vaccines across India, the experience and knowledge accumulated by drone companies and government would be worth in gold, as it will come handy in the years to come. A research report led by Hopkins, Bloomberg School of Public Health indicated that drones in the medical field have the possibility of improving vaccination rates and aid in various immunization programs held globally. The Ministry of Civil Aviation has given the permission for experimental drone flight operations to SpiceJet, Dunzo Air Consortium, Skylark Drones, Swiggy and 17 other entities beyond the visual line of sight. A leading logistics company, Blue Dart, has announced that it will deliver vaccines and emergency medical supplies using drones. This initiative will be a part of Telangana's Medicine from the Sky project. Blue Dart will roll out the pilot project under a new entity, Med Express Consortium. Speaking to a leading English daily, Ketan Kulkarni, the CMO and Head of Business Development of Blue Dart, said, "With efficient systems in place, it can help reduce the logistics cost, making the healthcare logistics faster and more efficient." The government authorities are conducting this experiment in a defined airspace. According to the Telangana government, the drone operations will commence in the 4th week of May or early June. We believe the government should continue to encourage the private sector to deploy existing and emerging technologies, including drones, for the progress of the country, even though some of the emerging technologies are in their early stages of development. Drones may deliver a small percentage of the total 1 billion plus vaccines, but they will deliver to critical, far-flung areas in emergency situations. That's all for today. We have over 400 startups and MSME shows on our TV channel. Do check out. My Startup TV is now available on Google Play Store, so you can get all the latest news on startups and MSMEs on the move. You can also support us by subscribing to our TV channel and do not forget to press the bell icon. You can follow us on Twitter, Facebook, Instagram, LinkedIn or visit our website www.mystartuptv.in.
दादी के हाथ का स्वाद याद दिलाए दादी मसाले.
So definitely My Startup TV will become a big voice and the face for the startups like us to spread the word and to share the innovation and the works what we are doing it in a one part of the city to spread entire the India, different parts of the city to know and spread over, because I think how do a government in Assam or a startup in Assam will know unless people like you kind enough to feature us and tell the story. And after that, the storytelling format is crisp and very engaging. So definitely, I think many founders like me will definitely follow and definitely we want to be part of it.
दादी के हाथ का स्वाद याद दिलाए दादी मसाले।
Welcome viewers to another episode of Panel Talk. We are going through crisis time. There is pandemic across the world, and India in the past few weeks has been affected. And the one that is raised to the occasion is the healthcare segment. As they say, during crisis, there are opportunities. It pushes mankind to come up with new ways of facing the crisis. What we have seen in the recent past is some disruptive ideas coming up. And one such idea is delivering medical supplies using drones. We have heard of drones, but the role of drones to save lives is something unique and new. My panel this week to discuss this topic of future of healthcare and technology, Mr. Vivek Tiwari, who's the CEO of Medica Bazaar. It's India's largest B2B platform, e-commerce platform that supplies medical supplies directly to hospitals and clinics. My second guest is Dr. Amresh Rao Malapati. He's a cardiothoracic vascular surgeon. He heads the department at Nizam Institute of Medical Sciences. He's also done his advanced management program in healthcare from ISB Hyderabad. And then we have the drone man, Mr. Prem, who's joining us from Hyderabad. His company, Mark Drone, has been awarded, is going to be taking part with Telangana government in the pilot project called Medicine from Sky. Welcome, gentlemen. Welcome to the show. Let's start by understanding, Prem, do you want to talk about the program that you're going to be part of, where your company is going to work with Telangana government in the Medicine from the Sky program?
So what exactly we are planning to do is with a helicopter, we are trying to bridge the healthcare gap from a district medical hospital or a warehouse to a PHC. So majorly what we are trying to do is delivery of the medicines, vaccine, diagnostic samples and blood for 50 to 80 kilometers stretch from a point A to point B. So through our technology and through the hardware, we're trying to bridge that gap. And we were the first company to demonstrate last year for the technology and the platform to DGCA and to the government of Telangana. And after that, they released the EOI for Medicine from Sky, and we've been selected for Medicines from Sky project with the government of Telangana and Volcanic Forum. And so we've in Vikarabad district, we are going to do the medicine and vaccine delivery from a district hospital to a primary healthcare center in the month of June.
Coming to you, Vivek, I would like to understand. You are a best person to understand the challenge of getting medicines from one location to another. And could you share what kind of challenges do you face? When it comes to delivering medicines, medical supplies, especially when it comes to rural India, remote parts of India?
Absolutely, very valid question. And let me start with the fact that any medical delivery or medical supply, it can't be substituted. Medical supplies in India is always need-based. It's always needed at the time when it is required, and you have to reach there. That's how, especially we look at healthcare delivery model, and we look at the supplies opportunity in the country today. I can tell you, we keep on getting multiple calls on our helpline where people need as on delivery today. Let's take an example, and no better than the doctor here on the panel can really tell you when he needed something urgently for the patient to be delivered today, he needs it as on today, because the patient life will not wait for 3 days or 5 days for someone to get some critical products or supplies. And this is what we have been facing every day in, day out, kind of. So at times it becomes really difficult for us to look at the challenges associated with critical nature of the products we are dealing with. Whether it is a vaccine, whether it is a blood product, whether it is certain critical surgical interventional products, it might be a basic stent to a say critical surgical, kind of mesh catheter, any kind of products which might be needed at time of whether surgery is done or whether the patient is being treated, it is needed then only, and you can't delay that. So this is where it is very, very time critical. It is a life-saving product. That is why I said the nature of product is that it can't be It can't be in a nature of waiting period for 3 to 4 days. So I'm telling you, these are when it is needed the most. You can't challenge that fact. So this is where I think a model like drone delivery, or a model like instant delivery, or a model which can reach inaccessible places or locations in India is the need of the hour.
Dr. Amresh, coming to you, when you talk about blending technology, today technology is touching every part of, our lives. It doesn't matter where we are or what profession we are in. With your experience, having been, you're also now, an expert with through healthcare management. How important is, bringing technology into healthcare, especially when we talk about something like a disruptive drones?
Healthcare has always been threatening to bring in disruptive technology, but that has never happened really. It has never really taken off. So what the pandemic has now done is it has put it all on an accelerated mode. So if at all the disruptive technology has to smash its way into healthcare, this is the time it has to happen. There is definitely no doubt that adoption of technology has its own challenges. There have been a lot of medical legal issues. There have been certain regulatory issues, definitely. But definitely nobody doubts the need of disruptive technology. Medicine has always been dependent heavily on personnel. It has been very personnel intensive. And for everything, we have been depending on persons. So, be it, of course, face-to-face interaction has always been the cornerstone of medicine, center stone of medicine. But then, if you look at nurses, nursing people actually spend more time documenting than in offering nursing services. You have ward boys taking samples all across the place. There are almost everything you say, you give it to a person and assign a job and you expect them to do it. Right from finding a bed, right from clearing their bills. It has been too much personal intensive. And what this pandemic has done is it has made it very important to protect the personnel. And it has said, look, now you dealt with people enough. Get in technology where role of people is limited and increase your efficiency. Increase your efficiency and get value for everybody. So definitely, I think technology helps. And when you look at something like drone technology, we are looking just right now maybe at just delivery of essential items or maybe transport of organs, or it has a much bigger role to play. I see tremendous role in it. If you think that by conventional thinking we might reach there, then it might take a little bit of time. But always disruptors have come from outside the system. So I think it's high time somebody from outside the system disrupts the whole thing and think the whole way we think of hospitals, think the whole way we think of delivery of goods or essential items, or how the logistics are panned out.
So Prem, clearly, as Dr. Amresh says, somebody from outside had to come and disrupt, which you are doing. Are you ready? I mean, it looks like the medical fraternity, the healthcare workers, and people like Mr. Vivek, they're all giving thumbs up to your service. Are you as a drone man and your company ready to take up the challenge?
Yes, we've been ready. We've been ready from last 2 years onwards itself because of the regulations, a lot of the challenges from the regulatory bodies and everything. We've been waiting for it to do it. And because of COVID, it has accelerated that, like the need and the trust on the drones have been increased and everything. So we are anticipating that at least in next 1-2 months, many states, like not only Telangana, many other states gonna come up with the first pilot study and feasible study and bring a roadmap how they could use drones in a longer term, year-long kind of activity. So what we are trying to do is we wanted to strengthen the existing healthcare system. That's where majority of people are in rural. That from a district hospitals to a primary health centers is what the keen interest is. How could we bridge that so that we could make it more accessible and the quality of service and affordable for the people? That's where we're trying to keep all our efforts towards. So because airspace is shorter than what we see on the road, and we're very confident because we have built 5 kgs, 10 kgs payload kind of a drones which can go for 50 kilometers and 80 kilometers. So we're very confident that we will able to cater and we will able to bring that the confidence to the government and to the medical fraternity that drones could become more enabler for them to do their existing things.
So Prem, the likes of hospital like Medica Bazaar, who will be primarily the suppliers to your companies like yours, where you'll be picking up the medical supplies and then probably delivering to the likes of NIMS and KIMS and other hospitals. What kind of changes or infrastructure change, addition or change they will have to do at their level so that your drones can go pick up the medical supplies and then deliver them?
So with the drones, what our drones can also, example for our existing 10 kg drone can have a 4 temperature control boxes where you can maintain for different temperatures. Like blood can be maintained at different temperature, vaccine can be maintained at different temperature. So already with the hardware, we have equipped with the temperature control boxes and everything, which can maintain like 3 to 80 degrees Celsius kind of a thing. Like companies like Medica Bazaar and everything, because they already have streamlined the supply chain. What we're trying to, this becomes a more extension to their service to provide in a shortest time and to cater to the demand and supply what has been created in the market at present, from a warehouses to the hospitals or from a central point to a more of a distribution points and everything. It becomes in shorter time and in a very reliable kind of mode of a transportation is what I could see going forward.
So Vivek, your company, Medica Bazaar, have you started, thinking on these lines that in a couple of years, probably drones would be one of the modes through which you will deliver your medical supplies? If yes, what has been the thought process within your board?
Absolutely. Medica Bazaar has always been, I would say, early adopter kind of a business model, right? We always want to do something which we feel could be the future and which we feel could be the problem solver or enabler for the business what we are into. Last year, in fact, we were the first company to sign up with Zipline. Zipline is the first company in the space. So Medica Bazaar and Zipline were the partners to explore this drone delivery model in Maharashtra, say for the initial rollout. And this was a kind of a effort by Government of Maharashtra and Serum Institute of India. We never knew that pandemic would be in such a scale or a state that all these projects would be shelved and people will be more concerned about saving life at this point in time. But this was done primarily early 2020. And this is where our talks started. And this is where we thought that we would first enable and get into rural areas in Maharashtra. Though this is not taken off completely for obvious reasons, because the government permissions and all are required, because this is a very sensitive space and there would be multiple challenges associated. There are security threats and all of those areas where the government is working on it. But I'm sure this will be given a very strong nod from the government to operate in certain locations. I'm sure Telangana government has been up on the curve and they have been trying to do this very strongly. There are other governments who are thinking about it. This is where we think, we are working with various providers and trying to see what best we can do, because we already know the complexity of product, the nature of the product, what Prem rightly said about different product management, temperature control, and we have an in-house team looking at all of this. What we really need to look at the infrastructure base and support, because somewhere we believe that drone management, while is it easily spoken, but there is a good amount of infrastructure needed. There are takeoff infrastructure needed. Especially you have to create a hub sort of infrastructure where you need to put drones there and you need to make sure that there's a takeoff point, and from there you can reach out to the different destinations or locations in different areas. Though I'm not a drone specialist to comment on that, but again, just telling you exactly what we have learned from industry, what we are trying to get from different sources. So this is where I think we are, kind of becoming an early adopter in this space, knowing the fact that it has taken off quite well into markets like Africa, where in countries like Rwanda or Congo, Zipline has been successful in terms of bringing down the turnaround time for blood samples and HIV reports for patients, especially the young children. I think this will be a great help for a country like India. As Dr. Amresh was telling, we are having dearth of resources everywhere. So this kind of a model has to be really a great model for an enabler for healthcare in our country.
Dr. Amresh, NIMS is a premier institution, and it has been always at the forefront of anything to do with with the healthcare. Has your team and your organization started thinking on lines of using drones in future?
Major Sunil, disruptive technologies, first of all, require a change of mindset, and they require a regulatory framework to operate in. One thing I know is that at least whenever you have a change, you need either early adopters or at least advocates and early adopters. And definitely NIMS has people who have that kind of progressive thought in mind, who are willing to try out these things that, hey, this looks good, this brings value, let me try it out. And as far as regulatory framework is also concerned, our chairman is the chief minister of the state itself. We have the health minister and the various policymakers on our executive board. So definitely we can try it as a pilot project with us. It definitely gives greater access to we have both adopters of technology as well as the ability to influence the regulatory framework as well from the medical perspective.
Thank you, gentlemen. Thank you for joining us on this panel talk, and we look forward to hosting you. Thank you, Vivek. Thank you, Dr. Amresh. And thank you, Prem, for joining us. Thank you.
Thank you all. Thank you. Thank you for inviting us here.
We have over 400 startups and MSME shows on our TV channel. Do check out. My Startup TV is now available on Google Play Store, so you can get all the latest news on startups and MSMEs on the move. You can also support us by subscribing to our TV channel, and do not forget to press the bell icon. You can follow us on Koo, Twitter, Facebook, Instagram, LinkedIn, or visit our website www.mystartuptv.in. Thanks for watching.